Hey guys, we're here today to do some breast work. And I know we do a lot of this kind of stuff, but this is a situation that's extremely common. This lovely 36-year-old woman has had a breast augmentation done 18 years ago. So these were older saline implants in her case, happened to be underneath the muscle. And since then, a lot of years have passed and she's had 3 children and things don't look quite like they did when she got them. So she's here for a secondary breast procedure. In this case, we're going to be exchanging those saline implants for silicone, and we're going to be doing a lift at the same time. And so in her case, we'll be taking out the saline, doing the lift. We'll show you a little bit about how that works. She's agreed to let us do the examination here, and we're very grateful for that. And I'll show you briefly how it works. When we do this kind of thing, we remove skin from the bottom and push the breast up. It's called a lift, but technically it's a push-up, and that's how we should think of it. Also today, we've deflated the saline implants preoperatively. So when we do our exam, you're going to see that there aren't breast implants in there the way you would imagine them. They're not full, they're deflated. So this gives us a sense of what kind of volume she wants in addition to the breast tissue that she has now. We're able to do a sizing system to determine the volume that she wants. And also it allows the tissue around the implant to have improved blood flow, decreases the risk of complications, and there's good studies to support that. Thank you for agreeing. We'll do this now. Let's take this straight off, and you'll just stand with your back against the wall. We'll kind of come over here. So you can see, relative to where her elbows are and relative to her collarbones, nipples are down here below the crease, and we're going to be removing some of that skin. And with that skin removal, and this is a very crude version, we're just going to be pushing everything up. We're going to make a new place for the areola, higher on her torso. We're going to make it smaller than it is in her case, about 35 millimeters. And then we're going to volumize this area up here with implants and make sure they're symmetric and make sure they're in great position. Thank you all for checking in. We'll cover you up. Thank you for doing the exam.